Hey, this is Michael Roberts. I'm the current Chief of Staff at East Alabama Medical Center, and we wanted to talk to you a little bit about our current peak in COVID-19 cases in our community and at our hospital, and a little about how it has affected us locally. Our pandemic experience here at East Alabama Medical Center started in the second week of March, when we admitted our first patient on about March the 16th. We had an early peak in cases. The first week of April, we reached over 60 patients in the hospital with COVID-19. It was all brand new to us then. It was none of us had ever seen anything like this before, and it was very challenging for us. We came to you at that time, and we began talking to you about things like keeping a distance of 6 feet from people outside your household and avoiding large gatherings and wearing a mask. And we felt like that was effective, and we got through that time. We hit our second peak in COVID-19 cases during July. This followed the July 4th holiday, and we've seen this trend where we have peaks in cases after times of gathering. The July peak was challenging because, unlike April, when many of the other things that we do in the hospital had low volumes, we'd begun to see those things return to the hospital. And so in July, we had a high number of COVID-19 patients, but also we're back to somewhat business as usual in the rest of the hospital. And so that begins to bring challenges as far as having enough staff to man the beds that are being occupied by those patients with COVID-19. Again, over time, we saw those numbers improve, and we entered the fall, never quite down to the level that we were following our April peak, but somewhat better than what we were at our peak in July. We knew we were at risk of having a third peak, and we all have been concerned about that following the holidays, particularly Thanksgiving and now Christmas. And unfortunately, that's exactly what we've seen. And so where we are today, we have 74 patients in the hospital today with COVID-19. That's the highest we've had at any point in the pandemic, and in fact, it's the third consecutive day that we've set a new high for our patients with COVID-19 here at East Alabama Medical Center. We have 263 total inpatients. So on top of all of these patients with COVID-19, we have other sick patients who are in the hospital for other reasons, things that we might typically do in the hospital when it's not during a pandemic. So we're stressed, we're stretched, we're having those same staffing challenges that I mentioned earlier, trying to get enough people to take care of these patients, not just the patients with COVID-19, but those who have been displaced to other areas of the hospital. East Alabama Medical Center is not alone in this third peak in the pandemic. We've seen rapidly rising numbers of cases of COVID-19 throughout the state of Alabama. In fact, currently, the state of Alabama ranks in the top 10 nationally in the number of infections and the number of hospitalizations per capita. This is not a top 10 list we want any part of. Our hospitals are busting at the seams all over the state. This affects not just the care at each individual hospital, but the normal patterns that might be utilized for things like transferring patients from one facility to another are very difficult to accomplish at that time because we're simply all reaching our maximum number of patients. So we're very concerned about this third peak and where we may be going. Typically, January and February are our busiest months in the hospital. This is when we have our highest acuity, our sickest patients in the highest numbers. But now we have another 70 plus patients with COVID-19 on top of those numbers, and it's just reaching a level that's not sustainable. The patients who are exposed to COVID-19 around Christmas Day are just starting to make their way into the hospital. So as those who became exposed then become sicker and become hospitalized and then progress to a point that they may need critical care, our challenges related to staffing in the hospital and physical space only become tougher. There's only so much space in the hospital, and there's only so much staff. And we are afraid that with these rising number of cases, in addition to the normal volume that we typically see in January or February, that it just may eventually become too much for us to handle. And so this is why we come to you now, to give you an idea about where we are and what the challenges are that we're facing, and to give you some ideas about what you can do to help us through this third peak. Similar to what we have talked about earlier in the pandemic, there are a few specific things that remain the most important in limiting the spread of COVID-19. Number one is keeping distance from people who are outside of your household. You have your core group of family that lives within your household, but those outside your household may even include people who are within your own family. We have seen spread of COVID-19 within family groups. That's what makes it so difficult around the Thanksgiving and Christmas holidays, because these are times that we typically gather with our family. You feel comfortable with your family, but I assure you that you can spread this virus to your family members. And so distancing remains important. Avoiding large gatherings likewise remains important, particularly large indoor gatherings. These are situations where the virus can very easily be spread from one person to another, and we continue to see this as a factor. Wash your hands. It's a very simple thing to do, and good hand hygiene is important, not just in preventing the spread of COVID-19, but a whole host of potentially infectious viruses or bacteria that can be spread from person to person. It's just good common sense, and especially so during a pandemic. And lastly, wear a mask. This has unfortunately become a political hot button topic, but I sure don't see it that way. I believe this is a very simple, selfless act that you can do that may protect you individually and may protect your family from becoming infected with a potentially deadly virus. So even with your family, similar to what we were talking about with spacing, even with your family, when you're with people who are outside of your household, wear a mask. We are very concerned about the way things are going. We want to do everything that we can to get through this third peak. We do, fortunately, have vaccines available, and so far they've been available to our hospital staff and to nursing home residents, but over the coming months, they are going to become available to eventually all of the citizens of the United States. And while that's very promising, this is not a short-term solution. We expect the vaccines to help limit the spread of COVID-19, but it's going to take a large number of people becoming vaccinated, and it's going to take several months to really see that effect. So that's why we believe that those same simple things we've been talking about from the beginning, social distancing, avoiding gatherings, washing your hands, and wearing a mask, remain the most important tools in limiting the spread of COVID-19. We are all weary of this pandemic. I can tell you that we are in the hospital. We are so exhausted from watching people struggle to breathe and watching people die from this horrible disease. I know that it has affected many of us in the hospital on a personal level, as I'm sure that it has many of you. So even though we are all weary of what this pandemic can do, on the effects that it's had on us personally, on the way that it's changed our lives, now is not the time to sit back. Now is not the time to let our guard down. It's as important for you as it is for us, and it's only together that we can all get to the other side of this. Thank you.